Good evening, everyone. Thank you for joining tonight's webinar. Our webinars are recorded via WebEx and will be made accessible online after. We're now using Cisco WebEx Event Center. If you're having troubles in joining, log out the session and rejoin through the link sent to you by WebEx or by entering our meeting room number 573-050-197 and password is Malaysia123. May we remind everyone that your mics are muted throughout the meeting, but you can chat your thoughts to us through the chat tab. And for questions, please type them in the Q&A tab. After this session, an email will be sent to you by the Secretariat. Kindly answer this survey so we can send the resources of this meeting to you. For tonight, our speaker is Dr. Fazila Alauddin, who holds a medical degree and the Master's in Business Administration in Healthcare Administration. She is Deputy Director of the Telehealth Division at the Ministry of Health Malaysia and is directly involved in both strategic planning and project management of eHealth in the Ministry of Health. She is responsible for health information systems under the Health Reform Agenda of Malaysia. Dr. Fazila is also certified in TOGAF and in COVID. May we now call on Dr. Fazila?
Hello everyone, my name is Fazila from Ministry of Health Malaysia. For the webinar today, I'm going to give you an update on Malaysian national eHealth projects and so forth. This will be my presentation outline. I'll give you a bit of a country profile, our structure in the Ministry of Health, some issues and challenges we are facing as a country and also in ICT. I will talk a little bit on health system transformation, the eHealth strategy, and give you an overview of all the eHealth initiatives, the big projects that we are having in Ministry of Health. And I would like to also share with you the eHealth capacity building that we are doing in Malaysia, and I will summarize the presentation. Malaysia is actually in the Southeast Asia. If you see, it's the central of within the Southeast Asia. We have Singapore in the south and Thailand in the north, and the East Malaysia, and then we have Indonesia, which is nearby. So I think this map shows you where we are, and if we have two land masses, which in between is the South China Sea. Our population is 30 million as of 2014, 30.2 million. We are actually a multi-ethnic and a multi-region population, majority being Malay, but we have other races, ethnicity, which is Chinese, the indigenous, the Indian, and the others. Our vision for health is to be a nation of healthy individuals, and we are supported by 8 health goals. This has been our vision and health goals for many, many years, and we are still committed to this. But what's interesting is our current healthcare system. If you notice, we have a huge public sector and also a private sector, so it's actually a dichotomous system, and there's no integration. As of today, public sector is mainly 70% by Ministry of Health, but we also have other ministries. Ministry of Education has the university hospitals, and then Ministry of Defense has the defense hospital, and we have some local authority who also has health facilities. Whereas the private sector is a huge sector where we have hospitals and GPs. In Malaysia, we have about 8,000 GPs, and whereas in our public health clinics, it's only about 2,000 over. And for hospitals, private sector, we have about nearly 300 private hospitals, whereas in public, for Ministry of Health alone, we have about 145 hospitals. So you can see we have a dichotomous system, both public and private. This is a Ministry of Health organizational chart, but I'm not going to go into detail, but I just want to tell you we go by programs, the medical program, public health, dental, and so forth. So we are very program-based, and we have many divisions, and every state we have a health state department. Therefore, you will see the ICT system traditionally has been very program-based, very silo, vertically, but slowly we are looking into horizontal and vertical integration. The functions of Ministry of Health, we have many functions, basically in the area of public health, monitoring and evaluation, policy making, and so forth. But we are also a huge person care provider in terms of clinics and hospitals. And so beside being a policy maker and also in terms of regulation and enforcement, we also provide service for the public. The Ministry of Health policy has always been primary care as a trust, where we have a national referral system and is supported by the secondary care, which is either regional or devolved. And this has been since our independence since 1957. So if you see the development of the primary healthcare services from 1960, we gained independence in 1957 to now, to reason, we have really evolved and we have quite a comprehensive primary healthcare service. And I think Malaysia is proud with its primary care services. But not forgetting, we also have an extensive secondary and tertiary care service from a state hospital. Every state have a big state hospital, a district hospital. We have many special institutes and also rehab hospital. So it's both primary and secondary and tertiary care. But what is interesting is if you look into the distribution of health facilities, the government health clinics and the health hospitals and the Ministry of Health hospital is fairly distributed across the country. But if you look into the private health clinics, it's mainly in West Malaysia, and also the private hospital is mainly in West Malaysia and more in the central region. Whereas in the East Malaysia is mainly a public government health clinics and also hospitals. So there is also some maldistribution of facilities in between public and private. And these are some of the issues that we will address for the next 5 years. And of course, some of the challenges in health, I'm not going to go in detail, but I have some of it is, for example, like many other countries, rising of healthcare costs, public-private resources imbalance. I mentioned earlier, we have both public and private, but there's much imbalance. Despite having many private hospitals, our inpatient is still very high in the public sector. The waiting time is still very high in the public sector. And our issue lately has been also the rising of non-communicable diseases, especially diabetes and hypertension, and that's quite worrying. And many more challenges in health. So since a few 4 or 5 years ago, we have started to move towards health system transformation. And we have realized that for the next 5 years, 2016 to 2020, these are our issues and challenges in health, mainly burden of disease, non-chronic disease, quality, accessibility, and so forth. So looking into this, we have to see how would ICT play a role in helping us with this. And we also in 2009 had a National Health System Transformation Agenda. In this paper of restructuring the Malaysian healthcare system, we wanted a restructured national health system that is responsive, with quality healthcare and also universal coverage. So the three areas we are looking at are good quality of care, equity and universal coverage, and sustainability. And three components that we are looking at. In fact, this is all work in progress. We hope by the end of 2016, we should have the blueprint for the National Health System Transformation Agenda. And three components we are looking at is service delivery, organizational, and also financing. Eh, sorry, okay. Malaysia goes by 5-year plans. So the 11th plan is in 2016 to 2020. If you notice, the vertical here, this is the health sector, achieving universal access to quality healthcare. This is a national plan. It is not Ministry of Health plan, but this is at national level. So health sector is one of the biggest agenda. And if you notice here, improving system delivery for better health outcomes is our focus for the next 5 years. Therefore, ICT will play a big role in improving the system for a better health outcome. So Ministry of Health also has to come up with a plan aligned to the national plan just now. So for 2016-2020, looking into all our challenges and looking into the outcome that we want, which is basically quality services, reduction in disease burden, healthy environment, we have 8 focus area here. And if you notice, ICT transformation for health has been put as one of the focus area for the next 5 years. And if you also look from 1, 2, 3, 4, 6, 7, and 8, all this will require some form of ICT system to help us achieve this focus area. So what are the eHealth strategies that this Malaysia is looking at? Now we are talking about eHealth. What I've presented to you earlier was mainly the introduction, the challenges, and also our health system transformation agenda and the 5-year Malaysia plan. Malaysia has many platforms for health informatics, I would say. We have political commitment in health, in IT, where we have program called Multimedia Super Corridor. This one started way back in 1996. So under this program at the national level, ICT in healthcare also gained a lot of momentum here. And we were doing a lot of hospital information system during this time. Then in 2010, we have this economic transformation program, which in here also addresses a lot of ICT projects, and health sector is one of the verticals. These are all national level projects, and where health sector is the one of the verticals, and all the other sectors, the financing, the oil and gas, the transportation, and so forth. So we have gained a lot from this national programs. But if you look into the second column, it's the national commitment. Mampu is actually the IT arm of the government under the Prime Minister's department. And we have a lot of centralized ICT initiatives where all ministries are the client for Mampu. So we have the One GovNet is our virtual private network, government network, and then we have the PDSA is of the public sector data center. We have the One Gov Cloud, One Gov Enterprise Architecture, and we at the national level, there's already commitment for open and big data initiatives and also digital opportunities. So again, health sector has opportunity in all these areas, and we have about 24 ministries. So Ministry of Health is one of the ministries who is the client to all these projects. Under governance and policy, this is Ministry of Health only I'm talking about, and also national level ICT eHealth plans. We had the telemedicine blueprint way back in 1997, where we envisioned what the country would be using ICT as an enabler. And we had all the other Malaysia plans, which is the National Health Policy, ICT Strategic Plan, and the 5-year plans which I told you earlier. For standards and interoperability, we have a lifetime health record business framework. We have many standards. We have a national health data dictionary. We use the IHE framework for our integration and interoperability. We have our Malaysian Health Information Exchange, which I will share with you later. And we have also just gained in late 2014 the SNOMED City country license. So we have agreed to use SNOMED City for our clinical terminology. So actually, if you look into this multi-platform, the one in reds are the one that is very important for the next 5 years, which is partly the economic transformation program. We have a lot of projects under this program. And then the government, OneGov enterprise architecture is also a very important program for us. As Ministry of Health will be one of the ministries to embark on EA. Our ICT strategic plan and our 5-year plan is also important in moving forward. And also the Malaysian Health Information Exchange is very important, especially in Malaysia where we have both public and private sector, and we are moving towards public-private integration. So this, in a nutshell, shows you all the multi-platform health informatics in Malaysia. In terms of ICT governance, I think this is very important, but this is mainly, again, public sector. Yeah, I'm not really talking about the private sector here. At the national level, national strategic level, we have the National IT Council, and then we have the Government IT and Internet Committee. This again by the IT arm of the government, and the ICT Technical Committee. So in terms of hierarchy, all the projects from Ministry of Health or any ministries will have to go through all this, will have to go through, just 1 minute, sorry. We'll have to go through all this approval before getting the funding from the Ministry of Finance. And at the Ministry of level, at the policy, strategic and planning level, we have the Ministry of Health ICT Steering Committee. This is basically for Ministry of Health for all the ICT projects and approval. But we also have a National Health Informatics Committee. This is a national level with National Health Informatics Committee is multi-sectoral and where we get a consensus on standards and data. And Telehealth Steering Committee is also multi-sectoral, both public and private, where projects under the telehealth projects gets discussed here. Then, of course, we have coordination and monitoring committees for all the projects, and at operational level, we also have the ICT project teams. So if you see, this is the entire governance for the national ICT project. As per many countries, our challenges are the same: policy and procedures, infrastructure, system, cost, and people. Again, in people, clinical leadership is very important, and we have big challenge when we are implementing hospital information systems in hospitals and clinics to gain buy-in from the clinicians. So that's important. And we really have a significant budget constraint. Our percentage for ICT compared to the total capex is quite low. This has to change if we want to move forward. But what we did a study on the issues in 2011 to 2015, the last 5 years, and these are our 5 main areas which we have to address in next 5 years, 2016 to 2020. Basically funding, silo implementation, issues in ICT infrastructure. We have about 2,000 over clinics and 150 over hospitals, where some of it, the infrastructure is not there. And we have a lot of data, but perhaps not much information. So we require quality data for strategic planning and management. And this time we have addressed ICT skills and competencies. So these are some of the ICT issues. So what we did was we came up with a model for ICT in health, and we thought these four areas are the foundation in order to achieve our goal for transformation. So each of these areas we have come up with an action plan, the Gantt chart, who is responsible, and so forth. So I would say leadership and governance, legal framework, enterprise architecture plays a big role. And if this foundation is solid, then comes all the other pillars, which is already ongoing. But we have also lately included monitoring and evaluation, which we think is very important. Some of our implementation way back in 1996. If we go back today, uh, some hospitals have gone back to paper. So this is very important to know why and how to move forward. Sustainability has always been an issue. How do we sustain ICT investment? How do we prove an ROI and total cost of ownership and so forth? And what is a good business model for the new developments in ICT? So these are all these areas that is being addressed for the next 5 years. So we developed our ICT strategic plan or information system plan of Ministry of Health 2016-2020, and we have just completed it and we are launching it in April. But we have aligned this ICT with all the other plans. I've spoken to you about the transformation agenda of the 11th Malaysia plan and so forth. So all this has been aligned. And this is our information system strategic plan for the next 5 years. So if you notice the top part, this is the Ministry of Health has come up with a strategic trust for the health sector, which covers four areas: strengthening governance, strengthening delivery, empowering individuals and community, and also collaboration. So looking into this strategic trust of the national health sector, we came up with an ICT vision, which we think ICT is no more an enabler. It has to be a driver, the mission, and this is the four areas we are looking at: the standards and framework, expertise. We have given a lot of focus on expertise for the next 5 years, data availability, and ICT solution. So these are all the clusters, and every of it has its own activity, its implementation plan, its Gantt chart, its short-term and long-term output. And so if you notice, this is our ISP. And we also have aligned it with the public sector ISP. This thing is in our language, in Malay language. But what I just wanted to show you is, sorry, the slide, there is some, the thing needs a line. But what I want to show you is the EA. This is the public sector ISP, where digital government is the main focus. So EA is one of the component in the ecosystem, the enabling ecosystem. And this public sector ISP is produced by Mampu. Mampu, I mentioned earlier, is the ICT arm of the government. So EA has been given a focus. So what we have done at the end of 2015 is we came up with the Malaysia OneGov EA framework using the TOGAF framework. And this was developed with the 57 government agencies, including Ministry of Health, led by Price Waterhouse consultant. And if you see, it's not much different from TOGAF, where it addresses 4 architecture domains. So for the next 5 years, all 24 ministries and 57 agencies must come up with their own EA using this framework. So of course, health sector is one of the ministries that has to produce this. So we decided that we should have a roadmap for our EA. So for 2014, 2015, we were so much focused on competency foundation. And 2016, 2017, if you notice, again on awareness, competency building. And 2017, we are hoping to have an EA office and also a maturity assessment to be done again and a repository. And it goes on and on until 2020. Our budget is based on 5-year plans. So most of our plan are 5-year plans. So if you see, EA is one of an important plan for the next 5 years. So basically, that is the overview strategy. Um, Next, I'm just going to give you some of the overview of eHealth initiatives. Okay, this is a very busy slide. This is what we thought the health information system should be. Sorry, there are some of the words has run from the original thing. Okay, if you really look into this slide, this is the center is the systems for patient care or population care, where the top part is mainly for all the systems in the hospital. The bottom part are all the systems in primary care, and then we have population health. We have some very specific institutional systems, for example, the public health labs, the blood bank, the national blood bank, and so forth, and also perhaps training centers and so forth. So, and then we also thought that the integration factor would be the lifetime health record, where the patient's record will be shared across. I will explain to you in a while. And at national level, we have many systems that covers all these functions. These are all functions. In each of it, they may have many systems. For example, in surveillance monitoring, we have a infectious disease monitoring system, e-dengue, and so forth. We have ENIA, eKPI. We have about 30 over patient registries. We have a professionals registries, especially specialist registries, and so forth. For regulation and enforcement, we have the food and drug safety system, the drug enforcement system, and so forth. But we also have a very important data warehouse here, where this is more of a secondary data for strategic planning, whereas the lifetime health record here is more of patient care data for continuity of care. And we are also hoping in the next 5 years to have systems for the citizens or the clients, which includes health portals. We already have health portals now, but we don't have e-scheduling, e-appointment, e-consultation, self-monitoring, and health apps. So this is the entire system that we picture. But in Ministry of Health, we may have some of these systems. We may have some in modular form. We have a primary care systems and so forth. But this is not, this slide is not peculiar to Ministry of Health. I think this is health system in general. What are the functions of the system should be. So in Ministry of Health, we are already developing some of the systems. Some we have bought off-the-shelf third-party systems and integrate with our systems. And some of it we are developing with a vendor for just for Ministry of Health. But what I'm going to show you is some of the systems overview. So for next 3 years, from last year, 2015, 2018, we thought we must have some quick wins for Ministry of Health. And if you notice, our hospitals, less than 30% has a system. This is only Ministry of Health, yeah? Less than 10% have a system in health clinics, less than 5% in systems in dental clinics, and we have issues in infrastructure, hardware, devices, and so forth. And so what we have done is, in terms of connectivity, it's already taken care by the VPN that is managed by the MAMPU, which is the IT arm of the government. And we are starting to roll out systems in hospitals and health clinics, and we've already started since 2015. If I show you the next slide, infrastructure, we are all connected via VPN, and it is centered in the ministry data center, in the public sector data center. We about 85% of our facilities are connected, and we targeted for 100% by 2015. However, we are having some issues with the rural clinics, so we have not achieved yet 100%. But if you notice, all our bandwidth differs, it ranges from 6 max to 30 max. And the headquarters, we have our own campus network. So this entire thing is actually managed services, and Ministry of Health is one of the biggest clients for this. And in terms of hospital information system, this is also Ministry of Health. We have 17 hospitals with commercial HRS. We have 9 hospitals with a very legacy system built mainly for billing. And we have 9 hospitals with a system that is built for Ministry of Health. We have 10 hospitals with so-called SPPDs, which is a legacy system. But what is worrying is we still have about 70% of our hospital which is still manual. So we are a mix of a commercial system and also a homegrown built from Ministry of Health. So this is our hospital information system. So if you see the system that is built for Ministry of Health, it covers quite a large range from registration payments to basic clinical documentation to discharge summary to order entries and all the other systems. So we have started from version 2.6, which covered just this part, and we have gone advanced, and now version 3.1 has included all the outpatient clinical documentation. And this year we have awarded to have the the EMR. So hopefully this system will be a complete system by 2018 to have also the EMR. For the primary care, we have an integrated primary healthcare system where it covers all, it's called TPC OCHIS, that means tele-primary care and oral health clinical information system. It covers all these various different kind of clinics in Ministry of Health. It also covers the outreach program, which is the school and community. And we are going to try a pilot this year, self-monitoring for hypertension and diabetic patients, where we will have a team sitting in the health clinics monitoring this data. And it has both online and offline mode through our VPN and to the public sector data center. So the pilot is 12 sites. We will go live in October this year. And the nationwide rollout will be phased out for the next 5 years, covering almost 1,000 over clinics. So we are very excited about this project. And this is a collaboration between Ministry of Health and also Ministry of Science. And the pilot project is done under a research grant. So, and the beta version is already ready. So this is something we are very excited about. We have also started the pharmacy information system. We have started the pilot since 2014, and we target to finish nationwide by 2018 implementation. This covers a single system for all the clinics and hospitals of Ministry of Health. And if you look into the scope, it's quite detailed. It starts from order management to ADR to medication counseling, data mining, and so forth. So this also we have a vendor, and we have started the project. Now the target completion is end of 2017. Our teleconsultation project was started way in 1997, mainly in 4 areas: telecardiology, dermatology, neurosurgery, and radiology, where we have the receiver and the sender. However, this is now being reviewed because many of the hardware is already obsolete, and we are reviewing the teleradiology, especially the teleradiology, and we have to come up with a teleradiology blueprint for the next 5 years. So this is also ongoing. Because we have many systems, different systems, and then we also have both public hospitals, Ministry of Health, Defense, and Education, and we have a huge private sector. So we decided way back in 1997 that the lifetime health record will be the key to interoperability. This will connect all the public sector facilities, the private sector facilities, regardless whether it has a system or not. And it will also connect to all the others, the researchers, the retail pharmacy, the private labs, and also other Ministry of Health function. So this was our framework. We reviewed this in 2006, and we are still holding on to this. This is our final target. However, what we have done is we have started small. We started small with My Health Information Exchange. We conform to the IHE framework. So in 2011, we had the version 1.0, where we shared only discharge summary and visit summary from the hospitals that has EMR, following the CDA architecture. So this was version 1. We added the e-referral, the lab reports, the radiology reports, and some very key images. So if you noted from just now, to 1.0 had the discharge summary, and this is what we are adding. And for the MyHIX 2.0, the project is supposed to go live in February 2016. So these are the participating facilities in My Health Information Exchange. We have 6 facilities in West Malaysia. And we are using the public sector data center for this, which is managed by Mampu of the PM's department. And for our health data warehouse, again, we have a comprehensive model, but we are going in phases where we have the data source and it goes through the analytics process and so forth. And for the presentation layer, we will have reports, dashboards, and also portals for public and of course, but this is of course definitely with a very much highly secured function. And this is also a collaboration with the Ministry of Science Agency together with Ministry of Health. So basically that's an overview of all the systems in Malaysia. I would like to also touch a bit on eHealth capacity and capability development, since we are all in eHealth. I'm sure most of us have seen this. This is the National eHealth Capacity Roadmap developed under the eHealth umbrella, and it's a very comprehensive roadmap. But basically, it covers 4 areas: leadership and governance, standards and interoperability, enterprise architecture, and project management. So what Ministry of Health has done is using this as a guide and looking into these 4 areas, we came up with also our eHealth capacity roadmap, where these are some of the things, training we are looking at, COVID, ITIL, and for standards and interoperability, HL7, ICD-10, SNOMED City, for EA, for project management, and also career path. And we are also very much involved in COIL and REACH under the AHIN program. But at ministry level, we have already started all this since 2014, all the training, especially HL7 training, SNOMED City, and ICD-10. In fact, for ICD-10, Ministry of Health itself conducts a lot of training. We have started training on TOGAF and COVID. We have people who are certified. We have a structured localized program for our project management. We have not really gone into Prince 2 and PM BOC. And for career path, we are sending people for masters in health informatics. Currently, mainly international, but our local universities have started this program, and we are hoping to send some people. We have also PhDs in ITs in Ministry of Health and also health sector as a whole. So I'm just showing you some of the examples for our competency foundation building for EA. We did awareness program. We have TOGAF certification training where we have 3 officers certified. For COVID, we have 2 officers certified so far for the last 2 years. And for BTEF, which is under the ISR, we have 9 officers, which is Business IT Architecture Foundation certified. So this is some of the example. We are done with this 2014, 2015. For 2016, 2017, this is our plan to have a complete package of competency for Ministry of Health EA architects. So we have planned this out. We have put a budget for this, and we just got approval in the recent ICT Steering Committee. So if you see for the next 2 years, we have a lot to do to prepare our people for EA, while at the same time getting involved in the OneGov EA project. This is an example of our Ministry of Health project management program. We are doing it in-house in collaboration with the National Training Center. So we have a 16 days program. I think this is what Ahin was interested for, and where the team goes through a series until they finish 6 classes. And the teams will start from here and finish up to Microsoft project. So this is a very comprehensive knowledge-based and process-based project management thing. But we are also hoping to send some of our officers for PMBOK and also Prince 2 project management certification. But for the time being, this is very localized to individual projects and projects that are ongoing who has got budget approved. The team has to go through this cycle of 16-day cycle. So basically, I've come to an end. In summary, if you notice, we started momentum in eHealth in 1996, and today we are in 2016. We have tried many ways. We have tried the Big Bang approach. We have tried direct negotiation. We had a lot of money during this period. We did rollouts and so forth. But somehow between 2010 to 2015, we reviewed and we decided to have a crawl, walk, and run approach, realign and start scaling. So this was the period of the economic transformation program and so forth. We also had a very lull period where the funding was very little. But 2015 is finished, and we are now moving to the era of 2016 of 2020. If you see, this goes by a 5-year plan. If you see at the bottom here, for the next 5 years, this is what we are looking at: nationwide rollouts, different business model, consolidation, managed services, and public-private partnership collaboration. I think it's very important. We can't do things alone. Cloud deployment models. In fact, the one I showed earlier, the primary care, is on a cloud deployment model. We are looking into mobile health, social media, in health delivery, big data, and open data. It is our aim that by 2020, we want to achieve a high-income nation. That has been the agenda. And we think this period for next 5 years will be the social transformation program and also the digital economic era. And we are moving towards the health. So in summary, you can see how health ICT has evolved and how we are looking into a new way of doing things. So basically, this is in summary. So I think I will end my presentation here.
All right. Thank you for that presentation, Dr. Fazila. We now have questions here. So for the first question, it's from Dr. Vijayan Ragavan. The question is, you did mention inadequate funding. Is there a budget already requested and allocated for the transformation plan during the 11th MP?
Oh, okay. When I say inadequate funding, that was our challenge in 2011 to 2015. But however, for 2016 onwards, we have already requested, but our budget is by projects. So most of our projects have been given budget. But as you know, when the oil price crashed, our currency also weakened. So we are having a lot of issues again this year in terms of budget, a lot of budget cut. But the project that is committed is ongoing. Yeah.
There's also another question from Dr. Vijayan. What types of manpower are you planning to implement the plan? To implement the plan, for example, in mobilizing SNOMED City for national implementation.
Oh, oh yes. To tell you the truth, we have not really sat down to say what type of manpower because a lot of work we are doing now is collaboration, and we have not brought in the other public sector and also the private. So in our national health system agenda, which we are already in the design phase for this year, we have to do the manpower requirement and the projections especially in moving forward the ICT. It is still work in progress, so I cannot give you the number right now.
There's also another question from Dr. Vijayan. What is the MOH plan when ICD 11 is rolled out possibly by 2018?
We right now we are using ICD 10, yeah, and we heard that ICD 11 will also incorporate will be aligned met to SNOMED City. So we will continue to use ICD for our diagnosis, but for the clinical terminologies, we have decided for SNOMED City, and the pathologists have decided to use LOINC for pathology, and for our drugs, we have our own Malaysian drug code, which is aligned to the ETC code. Um, so as of now, we will just do the mapping from ICD 10 to 11 and so forth. So we will continue ICD for diagnosis.
All right, thank you, Dr. Fazila. Another question. This is from Dr. Luoksai. How was health information system at village level in Malaysia, and how can it be integrated to the CRVS?
Say again, how was the what? The first question I didn't get.
How was health information system at village level in Malaysia?
Oh, you mean rural level, rural area? Village.
Yeah.
You're talking
Yes.
about village. Yeah, okay. Most of our projects are mainly at the urban hospitals and also clinics. So for rural areas, we still have issues in connectivity. And so we have to address that first, connectivity. We still have issues of infrastructure and hardware. So for the next 5 years, we are trying to see how we can achieve systems into rural clinics. It's still a big problem right now. So mainly the urban is covered.
And another question from Dr. Luixa is how can you integrate it to CRBS,
Oh,
the health information system?
okay, our national ID, our ID comes from the CRS, from the National Registry Department. So all our birth and death, everything is connected to the National Registry Department. So every birth in our hospitals is sent near time to the registration department. So it's all connected for the time being, but still we have not covered the nationwide. Only hospitals that has a system. And as you know, we have quite a matured CRVS system, and we are collaborating also with the National Registry Department in this. And we have a single ID number for every citizen, and we have a national ID card. So in future, we are also looking into putting in health data into the national ID card, but maybe a static health data.
All right, thank you, Dr. Fazila. If there are no more questions from the attendees, we have this question from Ms. Christine Pascual of the Asian Secretariat. The question is, do we follow protocols or other security mechanisms to make sure that health records is securely transmitted from one facility to another?
Oh, of course, it has to be. It follows the protocol. And I think privacy, security, privacy, confidentiality is the utmost important in all the ICT projects in health sector. So we adhere to that, and we also our system also goes on our virtual private network to the public data sector data center. So, and we have to follow we have certification for security, and we have strict guidelines for security. And we follow the ISO standards also for security.